Let's talk to the Health Secretary, Matt Hancock, who joins us now. Good morning to you, Health Secretary.
Good morning. How
Good
are
morning.
you?
I'm very well indeed. I'm very cheered on by the good news today about this, yesterday, the new treatment.
Yeah.
Dexamethasone, a steroid, costs just £5, 50p a day, £5 a week. A major breakthrough saving lives. 1 in 8 of the seriously ill could have their lives saved as a result. This is a major breakthrough for British science, isn't it?
It's a massive breakthrough. It's the first breakthrough in terms of a treatment that's been scientifically validated. I'm really proud that's happening here in Britain. We've had some discussions about whether we should back the science and base our policy on the science, and this is it really coming off because the scientists at Oxford University and in my team, Jonathan Van Tam, the Deputy Chief Medical Officer, have done a brilliant job. Following this, in February, they told me that there was a chance, a theoretical chance of this working. We've done the trial. We've also bought the drug up so that we've got plenty of it. And, we created a stockpile so that meant that not only I got the results late on Monday. By Tuesday afternoon, we changed the treatment in the NHS so that everybody is now getting this drug if it can benefit them.
And of course, that's been the problem, hasn't it? We were actually advised early on not to use steroids because it would lower immunity. But we're learning so much more about this coronavirus now. There's been some concerns about a possible second wave in China. Beijing has shut down a number of neighbourhoods, closed down schools. Are you concerned about a second wave here in the UK?
Well, look, it's always got to be a concern because we've succeeded in flattening the curve and getting the rate of transmission right down. The Office for National Statistics say there's around 4,500 new cases a day on the latest stats, which is much lower than it was, much lower. And we've got to keep it that way. But what we also want to do is release people's freedoms, get the economy going again. And the judgment is that we can only do that in a way that is safe. But there are signs from some other countries around the world that their rate of infection is going up. And it's just so important that we keep an eye on that and that we protect people here.
And reports today that 2 million people plus who've been shielding the most vulnerable people who've been told to stay in their homes, have no contact with the outside world, that they are going to next month be told it will be safe for them to leave. Is that true? Can you confirm that today?
Well, I can't confirm that yet. Again, this is based on scientific advice, and we will be setting out more details in the next very, very shortly.
But you're not denying it, so there is hope for those people. They'll be out of their homes in safety next month.
Yes, and it's really important that that this is based on the scientific advice because, of course, protecting those who are most vulnerable to this virus is so important.
Okay.
But at the same time, often they've had to spend now more than 3 months at home. It's a very big burden on them.
Right. Well, the government's been taking a lot of scientific and medical advice, also now taking advice on policy from 22-year-old England strikers. Marcus Rashford won a victory, causing the government to U-turn yesterday to provide free school meal vouchers for the 6 weeks of the summer holidays. If the policy is worth spending money on, and if these children were going to go hungry if they didn't have access to these vouchers of £15 a week, why was that not already government policy?
Well, I think it's the right decision. And
no, but then it would have been the right decision before Marcus Rashford campaigned for it. Why was it not already? If it's the right decision yesterday, it would be the right decision before yesterday.
Well, the Prime Minister last week made an announcement putting money into this area, and I'm delighted that he found some more money available to be able to do that, to go further yesterday. I think it's the right decision. And what matters to me as Health Secretary is the substance of making sure that we support the most vulnerable people this summer, especially because of COVID and the impact that that's had on so many families. And so I think it's the right decision. I also pay tribute to Marcus Rashford and the way that he's campaigned, with such passion, but also extremely, in a really civilised, persuasive, powerful way, using his own personal experience. But doing it in a way that I think really commends him. And this is the sort of way that political debate should take place, in my view. a high quality exchange of ideas.
Okay, a high quality exchange of ideas. I think the whole country will back you in your praise of Marcus Rashford and how he's handled himself in this, and the dignity and the cause. But I come back to the same issue. If as of yesterday, it is a good idea for the government to spend £120 million of taxpayers' money making sure that 1.3 million children eligible for free school meals get those vouchers over the summer, why wasn't it a good policy the day before? And why wasn't it even a good policy yesterday about 8 o'clock in the morning when I spoke to Grant Shapps, your colleague, the Transport Secretary, who said that well, it wasn't necessary to spend that money. It's either that money is either needed or it isn't. If it isn't needed, I'd rather my taxes weren't spent on something that wasn't needed. And if it is needed, why was the government not providing that cash already? Why did you have to be persuaded by a 22-year-old footballer?
Well, the Prime Minister makes judgments about these things, and I think that the judgment that he's made to ensure that money's available is the right one. I mean, that's that you've got to look at the substance of these things, Julia. I think everybody will welcome it.
Okay, I'm looking at the substance of it, and that's why people want to know why it wasn't already a policy.
No, people are more interested in what's actually going to happen, I think. But there you go.
I think people are quite intrigued by the idea that the government is making policy on the hoof based on what's being tweeted by famous footballers. I think that is a concern to people.
No, I'm not sure that's right. I think that in government, there's always you always listen to voices. You always listen to people making arguments. I think that the better put they are, and the more constructive they are, the more likely they are to get a hearing. And the Prime Minister makes judgments on these. It's an area that I have quite a lot of interest in as Health Secretary, making sure that people are able to look after their kids over the summer.
Absolutely. I think we all agree with that. Let's also talk just very briefly, if we can, about the government's decision yesterday to move the foreign aid budget into the Foreign Office, basically abolishing the Department for International Development, keeping that 0.7% of GDP budget, though. David Cameron, former Conservative Prime Minister, along with Tony Blair and Gordon Brown, criticised this. Cameron said this would mean less respect for Britain overseas. Do you agree?
It's a rare occasion, but no, I don't. I think that having the very generous amounts that we spend on aid being strategically tied together with our foreign policy, I think is important. Almost every other country around the world does it the way that we are now going to do it. Including other very generous countries. Countries that are as outward-looking and focused as Norway was the example that was used in the House of Commons yesterday. I mean, almost every other country does it this way, and so I think there's good sense behind that.
Next thing is to get rid of the 0.7%, but there we are. Matthew Hancock, I know you have to leave. Matt Hancock, Health Secretary there. Appreciate you joining us.